Bone marrow transplant, also known as stem cell transplant. This is a medical procedure used to replace damaged or diseased bone marrow with healthy bone marrow cells. The bone marrow is the spongy tissue inside the bones where blood cells are produced. A bone marrow transplant may be necessary if a person has a disease that affects their bone marrow, such as leukemia, lymphoma, or multiple myeloma. It may also be used to treat certain genetic disorders, such as sickle cell anemia and thalassemia. During a bone marrow transplant, a person receives healthy bone marrow cells from a donor. The donor can be a family member or unrelated person, or even the person themselves, if they have previously stored their own bone marrow cells. The transplant process involves first removing the damaged or diseased bone marrow cells from the person's body using chemotherapy or radiation. Once the old bone marrow cells are eliminated, the healthy donor cells are infused into the person's bloodstreams. These cells then travel to the bone and begin producing new healthy blood cells. After a bone marrow transplant, it may take several weeks or even months for the person's immune system to fully recover. During this time, the person will need to take extra precautions to avoid infections and other complications. They may also need to take medications to help prevent rejection of the new bone marrow cells. Overall, a bone marrow transplant can be a life-saving procedure for people with certain types of diseases. It can help restore the person's immune system and provide them with a new lease of life. However, it is a complex procedure that requires careful planning, close monitoring, and ongoing medical care. Follow for more.